Hello, ICS. My name is Lindsay Wagahoff, and I am the Director of Governmental Relations for the ICS. I'm going to bring to you a series of videos that accompany our Speak Up publication. So the videos are going to cover some little short how-tos on some of our talking points or some of our key issues that we discuss in Speak Up. The video is not going to be able to be perfect. This is exactly how the conversation is going to go, because every conversation is going to be different. It might be because you guys find interest in common and you start talking about some of those common interests, which also helps cultivate that relationship. Might be because of the questions asked. I can't sort of predict some of the questions legislators might have for you, and where that sort of conversation might lead to, and it might simply just be common interests and things like that. So while we do our best to give you some of the talking points, it won't be perfect as far as exactly how the conversation will go. But keep in mind that the point of these meetings with the legislators is for you to develop a relationship with them, and so that you sort of maintain that relationship. So if some of that conversation is common interest, that's totally okay. We want you to be able to do that, and so we want them to be able to think of you when they think of chiropractic. And so that having those conversations is important. So today's video is going to be about patient access. We have a piece of legislation out there that we have put forward that faced some opposition this year, so it didn't really move much during the legislative session, regarding patient access and taking that 2706 language from the Affordable Care Act and putting it in Illinois state statute. And the whole point behind that is that we want for the patients to be able to go to the provider of their choice and for insurance to cover that care that is received. So the patient isn't sort of put in this conundrum of I have to pick a different provider because of insurance and things like that. Well, that is to maintain the Affordable Care Act. We also would like it in Illinois state statute. So when you're talking to your legislator on this issue, sort of convey that point about patient access and your experience with that. The most important thing is taking your experience and letting them know why this legislation is important, and so they see it from your perspective. Like I said, this legislation didn't move much this year. We're hopeful we're going to continue to try for next year and look for avenues and way to advance this legislation, but definitely have that conversation and let them know how it affected your practice and how some of your patients personally. And so that's sort of patient access. It's the 2706 language from the Affordable Care Act. If you have any other questions, let me know.